everybody, and welcome. Really happy you're with us today. We are here for our first LGBTQ Health Equity Speaker Series session. This happens to be the first of a four-part series. This is on the COVID-19 vaccine, and this is brought to you by Accenture and CVS Health. So I am really happy to be here today. I am Tammy Lewis. I am the Chief Marketing Officer at CVS Health for both our CVS Caremark and our CVS Specialties divisions. And thank you so much for tuning in and joining us today. This is a very timely and a very critical discussion. There has been, quite a bit of, distrust in the LGBTQ community, the government and the healthcare system. And this has really, started back with the AIDS crisis, and it's continued currently with the transgender community. And recent studies have shown that the LGBTQ people overall are more hesitant than straight counterparts to getting vaccinated against COVID-19. So this is an incredibly important panel discussion today. And I'm here with a host of experts that are going to share their insights on the COVID-19 vaccine within the community, really against the backdrop of overall health equity. And these experts are here today. They're here to answer very real and relevant questions from those in the LGBTQ community. Things, such as the pandemic impact on the community, inclusive of youth, transgender, and the elder populations. We're going to look at interactions of the COVID-19 vaccine with ARV and hormone therapy drugs. We're going to also look at the effects of the current pandemic on mental health and homelessness in the LGBTQ community, and also the disproportionate effect on intersectional minority communities and those underserved from the pandemic. And incredibly important, ways of building trust moving forward. So today I am joined by 5 experts. Joel Helly, one of my colleagues and friend from CVS Health. Joel is the VP of Physician Services for CVS Specialty. Here with Dr. Michael Peterson. Michael is the director at Accenture, and he leads the Health Equity and Innovation group. We have Maurice McCants-Pearsall from HRC, the Human Rights Campaign. Maurice is the director of HIV and Health Equity. And we're also here and joined today by Tim Johnston, who is the senior director of national projects at SAGE. SAGE is the nation's largest, and it's the oldest organization that's dedicated to improving the lives of LGBT older people and their caregivers. And also here today with another colleague, Erica Adler, who is a PharmD, a pharmacist, a pharmacy manager here at CVS Health. So thank all of you for joining us today. Before we're going to start, it's a delicate topic and it's a delicate conversation. So if it's okay, I'm going to just set a few ground rules with everybody. First, ground rule 1. I think we have to really accept that everyone does not have all the answers. Second ground rule, please, let's give grace to others. And the third is, today, this is an exploration of health equity. And we're really excited that you're all taking part of this. So I think first, can we start with some definitions of equity and equality? I think it's important. So if we think about equality is treating everyone the same, right? Same access to opportunities. When we look at equity is really focused on, having a fair, a just distribution of resources and opportunities that are needed to achieve well-being, if we think about health equity, and really striving to achieve the best possible outcome for each individual. So, okay, with those definitions aside, there are a lot of efforts underway right now, really focused on raising awareness about the importance of vaccinating. A lot of entities are involved, and one entity I wanted to just speak about is the Ad Council. I'm not sure how much everyone is familiar with the Ad Council. It's been around for a long time. It's a nonprofit organization. They produce, they distribute, they promote public service announcements on behalf of a whole host of individuals, sponsors, nonprofit organizations, non-government, organizations, agencies of the U.S. government and others. And the Ad Council recently announced a campaign. It's called It's Up to You. And it's really intended to compel as many Americans as possible to get the COVID-19 vaccine as soon as they become eligible in their state. It's a collaborative of a lot of partners. There's actually been over $500 million donated in media to address vaccine hesitancy. And I believe that this effort is likely the most expansive campaign that the Ad Council has executed really in their story history. So it's a real landmark campaign. I think everyone's going to start seeing that. CVS Health is one of the founding members of the group, and that it's behind support. And you're going to be seeing that marketing campaign in action with those media dollars. We are really excited to be a part of it and very involved in this area and this effort in raising vaccine awareness. But I think with that, I'm going to turn it over, Joel, to you and really ask you to please talk a little bit more about CVS Health's role in the COVID-19 vaccination process.
Sure. Thank you. I'm hoping that I know a bunch of people out there because I am part of the Pride CRG, and I've been with the organization 25 years. And when you've been here this long, you tend to know lots of people. Pharmacist by training. I spent the first 15 years in the PBM out in the community with doctors. The last 10 years I've been with CVS Specialty, and my team is out there helping patients navigate through getting started on a specialty medication. And recently working with patient groups in the same health equity world for patients with rare disease who have health disparities. And how can we help those patients specifically and create more equity there? I've also been on the CVS COVID Executive Task Force the last, since COVID's been around, and on a chair of our Diversity Management Leadership Council the last 2 years, part of that council the last 5. I just actually ended that in December, which I'm going to miss. So the past year, I feel like it's been so tough for so many people dealing with COVID. And I've actually been so proud to watch the role that CVS has played in testing and now vaccinations. Seeing all our frontline workers out there every day is just so humbling to me. And, when bad things happen, people still need medications. That doesn't go away. CVS saw a need for testing. The retail side, just jumped in and created a plan. And we are in a unique opportunity because we have 10,000 stores across the country to go to those areas where there are health disparities. And as far as vaccination, so we started that with testing, and now as vaccination goes, CVS plays a role in a bunch of areas. One, we've doubled the number of states where CVS locations are now offering vaccinations through the Federal Retail Pharmacy Program, which is a little different than each state program, right? Each state program has its own issues in the way they make people eligible. There are a broad range of eligible populations. The Biden administration recently announced through this program that educators, staff, childcare workers are now eligible. And I think about 30% of our vaccinations today are happening in that population. The long-term care facility vaccination program was really amazing to see, right? So we vaccinated residents at over 40,000 sites, and we've seen a dramatic drop in both cases and deaths. In fact, between December of 2020 and February of 2021, we saw a 94% decrease in cases and an 84% increase in deaths. We hit 1 million doses of vaccines delivered in 17 states, and now it's already been a week, so the number's probably much higher than that. You can't keep up with it. I can't say thank you enough to our frontline workers, and I wanted to just take a minute. We have Erica Adler on the phone who's out there doing it every day from the front line and say, thank you, thank you, thank you. I'm in awe to what you've done over the last year, and let's give her a little bit of a round of applause. Thank you, Erica. So amazing, all that you've done. And so today I'm excited to talk about the vaccine and how it impacts our community, answer any questions. And by the way, after this, anybody can always reach out to me at any time with anything, any questions or concerns. And with that, I'll go back to you, Tammy.
Thanks, Joel. I think maybe we could turn our attention a bit to really specifically the LGBTQ community in terms of the history here. And, there has been this undercurrent of distrust and hesitancy in the vaccine. I mean, let alone in healthcare in general. So, Maurice, I'd like to start with you. Could you talk a little bit about why there is this distrust and specifically hesitancy regarding the vaccine?
Sure. Thank you for having me today. I am glad to be here, part of such an amazing and dynamic panel. Thank you so much to CBS. One of our latest reports shows that, there is a directly correlation between LGBTQ hesitancy and vaccines. The report also shows us that many people live at the intersection of multiple marginalized identities. There are some folks who are willing to take the vaccine, but are less likely to say that they want to take it. And furthermore, the LGBT community holds a diverse array of concerns about the vaccine. And, that ranges from concerns around side effects to perceived cost of obtaining the vaccine. So those are some things that we have pretty much highlighted in our report. But our latest report also builds on our past research about the economic impact of the pandemic, particularly on the LGBTQ community. I'm not sure if everyone was able to see the data, but 42% of LGBTQ people of color say that they have concerns about the vaccine not being effective, and that's compared to 34% of the the general adult population. And there's about 22% of adults and 24% of LGBTQ adults of color also who are currently unemployed due to the pandemic. Now, that's something to really kind of sit and focus on. Because that's an overall 7-point increase from, the 15% for LGBTQ adults and the 17% for the same population, but of color since the November election. So in the end, medical mistrust, what we know is that medical mistrust among communities of color is real. And then you take that or have that compounded with the handling of the COVID epidemic under the Trump administration, and all roads leads to skepticism, which is in direct correlation with the hesitancy, particularly for Black and Latinx folk.
It's interesting as you were talking about some of the questions or the concerns and safety. We have seen this. We've done a lot of research on vaccine hesitancy. So, questions about safety, there are questions about efficacy. And then you were talking about those questions about costs and the concerns there. Those are all things, do you believe, though, through increased education and awareness, some of that will be able to, be overcome?
Most definitely. I think that's why it's important for us now to really focus on public education campaigns, right, that really address those issues, efficacy, cost, and constraints for some folks. But I think that's the myth, right? People think that there's a cost associated, and just being able to inform the community of what's really at stake. I think, we're in the middle of a public health crisis. So we have to really apply all of our public health knowledge and tactics that we learned in school, right? So, yeah, I think, first we have to start with a comprehensive public education campaign.
Yeah, I agree. And at CVS Health, we have made it very clear. We're trying to ensure that it's clear that when you go to seek, if you could get vaccinated, the first thing you see that is no cost, because we think that is critical, that everybody understands that. So Tim, a similar question to you. You work with SAGE, and your work with the organization, really, you have an interesting perspective because you've been able to see this from a very generational perspective. So if you think that the HIV epidemic and other negative legacy events, how have they impacted trust as it relates to the COVID-19 vaccine?
Absolutely. Thank you so much for that question, Tammy, and thank you for inviting SAGE to this really important event. I'm really happy to be here. I want to underscore everything that was just said. Those are dynamics that are at play right now for LGBT older folks as well in this dynamic. But I do think it's important to really reflect on the legacy of the HIV/AIDS epidemic and what that experience was like for folks who lived through it. Not just older folks, but also baby boomers, members of Gen X. It affected a lot of people. And specifically, the experience of having a traumatic health crisis in the community, but a callous and slow response from mainstream institutions and from the government that really didn't change until there was direct activism and protest. And I think that that lesson that was learned really changed the way that people trust large institutions. So it's another reason that it often takes a lot of effort to convince people that these institutions do have their best interests at heart and that these are important public health interventions for them to join in on. I'll also say, just psychologically for the community, there's often the experience of survivor's guilt, where why did I make it through and so many of my friends and loved ones didn't? And some of those feelings can be re-triggered in these moments, which makes conversations about trust and engagement with community partners a little bit more complicated. But there's also a lot of resilience that comes out of that experience. And when we talk about messaging and ways to work with LGBT older folks, I think we can also focus in on some of the cultural aspects of taking care of our own that were developed through that experience.
Thanks, Tim. I appreciate that perspective. Mike, could I ask you, can you talk about the legacy impact of health disparities and then the subsequent layering of COVID-19 on top of that?
Sure. Thanks, Tammy. And thank you to CVS and Accenture, especially Melissa and her team, and Kristen and Suzanne and our team. I think this is a great opportunity to really just put this voice out there. We see it commonly a lot in underserved communities of color, but really the voice of the LGBTQ community has to be heard and amplified. And so I'm really excited to be here. So thank you for letting me share this conversation. To get to your question, what we are talking about is just an underlying chronic challenge where the pandemic is really on top of an epidemic of poverty and a really fractured public health system. And so this pandemic really shone a light on these fractures. And it's been alluded to already in the setup for this discussion. And when you think about that, you're really talking about poverty as a leading indicator for outcomes. It is statistical evidence-based medicine shows this. In the LGBT community, you also have similar challenges with a disproportionate theme around access to care, especially if you're in the LGBT community and you're also a person of color, you get a double whammy. And so what ends up happening is you have this where you live really defines your outcomes by zip code. And so when you really think about access to care as the really defining feature in the ability to understand how poverty impacts your health outcomes, for those in the LGBT community, really what is happening is there's evidence that shows that the community doesn't access health in the same way that most people do because of a lack of trust, as what we've just described. And then more importantly, they have, weathering just like communities of color, where when you have stigma and you have discrimination, you have this elevated cortisol levels. So now you live in an underserved community, but you now also have elevated stress, and that stress leads to poor outcomes. So really what you're challenged with are these chronic diseases that the pandemic, it puts you at risk for: obesity, lung disease, heart disease. So if you have all those set up already, you were already challenged when the pandemic kicked in. And so lastly, it's health equity, and this pandemic has taught us that you have to have a multifaceted approach because it is an incredibly complicated problem. And the evidence of this group here being from different aspects is sort of it should be the framework of how we think and talk about it, but how do we take action to solve it?
Yeah, as you're describing the individuals with comorbidities, those are the most complex. I mean, if anything, those are along with the elderly who were the first to be vaccinated. Those are now the population that's being prioritized across the states, and so important to really get vaccinated. So if I think about the frontline community, I'm going to turn to Erica. Erica, Joel, I guess maybe he stole the clapping for you, and I'm going to again. It's a big heart in terms of the role that you and all of the frontline workers across the nation have served, and you've been in pharmacies for over 20 years. So you've seen a lot, and I'd love to hear your perspective of what you're seeing and what you're hearing.
Thank you so much for having me. Definitely community pharmacy is a really unique position on the healthcare team. I have unparalleled access. You can call me, you can walk up to my counter, and I'm right there for you in your community. So wherever you have a community pharmacy in all of these neighborhoods we were just discussing that may have health disparity, you have your pharmacist right there. And we can answer your questions for you. We can help give you assurances. You've trusted us for this long to take care of your medications and help you with over-the-counter and self-care. And we're right there too in the community. So this is no different. Throughout this pandemic so far, I would say that some of my biggest concerns from patients would be initially around access to medication, something that I guess I wasn't quite prepared for. I work for such a large organization of CVS that I know that we have people in place making sure that we don't run out of things, and that we have people and making sure that the pipeline of medications are coming in. But that was one of the first things that I experienced. And specifically, one of my HIV patients called me aside and he said, this is a big deal. I've done a lot of research. I know where my medications are made, and I'm very concerned with raw materials and whether or not you'll be able to continue to provide this to me. So I worked with him and made sure that he absolutely was going to have a minimum of 6 months medication with an elastic around it and his name on it, just to give him some of that extra assurance. And I feel that there's many of me across the country that did things like this for our LGBTQ patients and all of our patients that were very concerned about these medications that they depend for their daily life and survival. So I was in a really unique position of access, and I hope that rings true for this vaccine part too. I'm a resource for information, helping dispel some of the misconceptions and misunderstandings. One of the biggest things that I have to work with is a soundbite from 2 months ago completely contradicts the new information about COVID treatments or options in the vaccines and what are we seeing. And we've never really had this play-by-play from the scientific community where the public knew the genetic sequencing of this virus. Like, you could Google it within a month of it coming to surface. And we've never really had that level of access to the information. And it's hard then when the public reads one thing and then 2 months later we're contradicting that and saying this treatment doesn't work anymore. And I've definitely been on the front lines for sure at trying to help dispel some of those disbeliefs and that now the hesitancy that it's led to. So
I think it's so interesting what you're saying. Well, first of all, pharmacists have been trusted, have been a trusted resource. I think there's been a lot of research done there. Often they're like the number one, trusted clinician. And it's interesting your comments about really also like the changes. Things are moving very rapidly. So I think I'm sure you staying on top of all of the information and being viewed as that trusted resource to have the latest information to share, I know is incredibly important and appreciated. So, thanks. Thanks, Eric, and thanks everybody for that framing. Clearly there is a lot of history at play here, and everyone's comments really it's a great primer about the pandemic impact. So we've heard consistently about the negative impact on health worldwide, from COVID-19. So if we could dig in a little bit to the LGBTQ specific impacts, Joel, I'd like to turn things back to you. You have been tracking a lot of the progress at CVS. So what are you seeing in the clinical impact for LGBTQ populations?
We don't know today exactly how many patients have been vaccinated who are LGBTQ, right? We know that there's a lot of stories of hesitancy that are out there. We know that during the trials, initially they weren't including people who had HIV, if they sort of told, right? And there was activism, like Tim said, to say, no, like you need to include these patients. And it helped. Once again, we learned. So in some ways it was great, but in other ways it starts to diminish the trust in what it means for the vaccine, right? One thing we know during the pandemic is that PEP and PrEP use significantly declined. Testing for HIV significantly declined. And so we missed a whole season of Pride's events that did testing. We had vans that are big, mobile vans that went through CVS parking lots to do testing. All of that slowed down or stopped. At-home testing, which I think in the past we somewhat wanted you to be with someone if you did find out that you had HIV. So we may have turned people a bit away from at home. All of a sudden, we're saying, no, get an at-home test. It's more important to know as soon as possible that you have HIV. So immediately after vaccinations, and even today, we should be thinking, how do we get everybody tested again, right, to make sure that they're being treated. There's also, for patients who have HIV who are typically going to their doctors every 3 to 6 months, that's not happening at the rates we would have seen before. We have to get back to that, right? So, and that affects every other comorbidity beyond just HIV, right? We also work with HHS to have, free PrEP through their Ready Set PrEP program. We've seen significant declines through the last year in that. And we want to see that, go back to increase. I think what we do know today is that the benefits of getting the vaccine far outweigh the risk of getting COVID, right? And regardless of the population, the comorbidity, if you have HIV, if you're on hormone replacement therapy, the benefits outweigh the risk of getting COVID. And so, I'm hoping today, all of us that are listening, all of us that are talking to each other can know that, because we do know that today. And there's been millions of people, 1 million at CVS alone, that we know got the vaccine. So, and you mentioned it in the beginning, but I think the mental health issues that arise in the pandemic and from the isolation of the pandemic are important, right? And they're not over. The isolation, all that stuff is still going on. People are starting to peak out and go back out, but we're just getting started there. And so it's going to take the community to be looking at the rest of the community to say, hey, do you need help? Hey, do you need help getting a vaccine? Hey, do you need help inside? Hey, are you alone? Can I help you get the vaccine? Especially as it relates to elderly, as it relates to youth. In Phoenix here, the largest homelessness population is LGBTQ youth. And so we need to be thinking about those populations. That's going to have to come, I think, from within our own community, a big portion of it. Companies and all that can do one piece, but within our own community, we need to be the biggest advocate there. So that's what comes to mind, Tammy, when you ask that question.
Thanks, Joel. I think the last point that you made about the community outreach, reaching out to others, I want to come back to that. I think we'll probably talk about that a little bit more. It's incredibly important. Tim, could you take this a bit further? We've heard a lot throughout the pandemic about how seniors have been, more susceptible to the virus, but I think there seems to be more to that picture. And what are some of the unique and the disparate impacts of COVID-19 on LGBTQ elders, specifically the elders, both those living in the community and those also living in long-term care settings?
Absolutely. We know that some LGBTQ older people experience health disparities that might make them more vulnerable to COVID-19. So there's that kind of base level fear, as well as legacies of job discrimination and other factors mean folks often have fewer resources. So it might be more difficult for them to reach out for help. When we're talking about folks in community, it's important to realize that for a lot of LGBT folks, their community are other folks their same age. They live in kind of chosen families. And it's been difficult for those folks to connect during the pandemic. Our LGBT senior centers in New York City, for instance, have gone all virtual, which is great, but you're not seeing people and checking in with them day to day, week to week. And that's really caused a lot of isolation and a lot of concern for our folks in community. The situation facing people in long-term care settings is very similar to other residents, which is that they have been even more isolated. And the folks working in long-term care facilities have done an unbelievable job during this pandemic. And it's also important to realize that family and friends often provide a lot of essential services for residents of long-term care. And with those folks not being able to visit, there's been a real strain there. And if you think about the perspective of an LGBT person in these spaces, if they don't feel comfortable disclosing their identity, that probably means they'll also hide their community. So they might not ask an aide to help them reach out to a friend because they're afraid doing so will out them. So we see some particular challenges as it relates to keeping people connected and also keeping them safe if they're also worried about whether or not they can be out within this place that has now become their entire world.
it's disheartening to hear that for the community and for those elders and that isolation. I think that we wanted to go back and talk about a little bit more afterwards. Maurice, you've been tuned in very much to the economic and the minority impacts through your work with the Human Rights Campaign. Could you talk a little about what HRC has been seeing throughout the pandemic?
In my work, I work very closely with consumers and advocates and community-based organizations that are really on the ground doing the work. And COVID-19 has had a devastating economic impact on the community. In September, we partnered with PSB on a report, and the report really showed us the disproportionate impact of COVID-19 on the LGBT community, even in states that started to economies. LGBTQ people were 30% more likely than the general population to have lost their jobs. And then when we look at that even closer, LGBTQ people were 50% more likely. And then when we looked at the communities of color, 150% more likely than the general population to have taken a pay cut. And these are folks who before pre-pandemic could not afford to take a pay cut. 1/5 of LGBTQ people of color had taken pay cuts, and we went even deeper into our data. 16% of those folks had taken unpaid leave as well. And that's compared to 6% of the general population. And sadly, the LGBT community population was 20% more likely than the general population to have experienced a reduction in work hours. The numbers are abysmal, right? This has had a disproportionate impact on our community, but particularly for those folks of color. When we went even deeper into our data, we saw that the LGBTQ population was roughly 30% more likely than the general population to have lost their jobs, period. And then when we looked at that and broke it down by people of color, we saw that, it was 70% for people of color. So sadly, here we are, a little over a year into the pandemic. And, those percentages for people of color in the broader LGBT community hasn't changed much.
Those statistics they're staggering. And it just underscores what a detrimental impact that this has had on the LGBTQ community. And it's going back to you talking earlier about costs and people being concerned about costs. I mean, it underscores even more the concern of cost and the importance to make sure that everyone understands that there is no cost to the vaccine and get out the information about that.
And I'll also add that one of the, when we look at our data, we see that, yes, LGBTQ folk are disproportionately impacted, but when we look at it by industry, it may be a shock to some that the hospitality management industry is an industry that's 40% of the employees are LGBTQ people. And that means when we look at restaurants and hotels, people aren't frequenting these spaces. So they were the first in many ways to have had a reduction in their work hours and or lost their job completely.
And I think we're all hoping with the vaccine and more people getting vaccinated that we will start to see, right, that coming back to be able to, I know we're all hoping we're going to be one step closer to doing all of the things that we have done before and frequenting, restaurants and travel and really hoping that this will have a change on the outcome and that there will be an increase of jobs and more people also going back to work. Okay, so maybe now can we turn the topic to vaccine safety and also accessibility. So Erica, again, you have been really on the front lines, and I think, in fact, you were in a location where that was one of the first COVID swab and send testing sites in the country. And now you've gone from being a swab and send location to becoming what, I think we refer to really as a vaccine depot store. So tell us a little bit about what you're hearing from customers about the COVID-19 vaccine? What are they saying about the vaccine?
Yes, Tammy. So we were the first swab and send retail pharmacy in the nation, and that was quite an experience. I was so honored to be able to provide that to my community. That business has not gone away. We have continued to do that through this entire process. And then we starting right after Christmas, we became a vaccine depot, where we were able to facilitate the long-term care facilities in our I'm in Massachusetts, so all of Eastern Massachusetts, we were supporting all of the long-term care and assisted living facilities, and we've been doing that since December. So one of the most eye-opening experiences I had early on for that, obviously overwhelming joy and thankful that I could provide this and be part of that. One of the first things I experienced is one of the parts of my role was to contact the facility ahead of time, just to confirm what I needed to bring for supplies. And what the team was going to need. And, we had an original estimate of what to expect, for a full census for all of the residents and all of the staff that were eligible. And the numbers they were reporting were quite low. And I was a bit surprised. These are the first people in the nation to be given access to the vaccine. And maybe a third of them or less were actually accepting that on our first visit. And I remember hanging up the phone and turning to my team, and I was shocked, and I said to my team, like, I don't understand, like, what could it be? And I have a really diverse team, thankfully, so they are able to give me input from their experiences and their cultures, their backgrounds, and a lot of them shed some light on that for me that I hadn't even considered. Distrust was something that, it never really occurred to me that there would be such distrust for such an amazing scientific breakthrough to keep us all safe. And I have a couple of Haitian colleagues who I asked, if you had access to this, would you get it? And one said immediately, yes, of course I would. Like, this is great. And her cousin, who is also one of my staff on my staff, said, no, I'm very scared. And I asked her to elaborate, and she explained to me that generationally through her family, there's just distrust for government, for large institutions, I think, like Tim had explained, and they were quite hesitant. And so I realized and took pause there very, very early on in the distribution of this, that we were going to be facing an uphill battle for something I thought was so such an easy sell, or such an easy no-brainer that everyone would want it. And that's when I realized that I play a much more significant role in this. Some of the hesitancy specifically was safety. So efficacy, has come out, and statistics are played with often in the media, and it's sometimes hard to know, is one vaccine better than the other, safer than the other? And frankly, any vaccine is safer than no vaccine when it comes to comparing it to the risks of getting COVID. Like Joel said, the risks of the real virus are much greater. But some people don't, that's not enough for them, and they need to know more. And who was involved in the trials is also important. And there was some good representation for some minority groups, but not necessarily HIV. I think it was like less than 200 participants in each of the Pfizer and Moderna trials, and then less than 1,300 in the Johnson & Johnson vaccine. So I can see how it would be hard for some patients to extrapolate that data to themselves and trust that it would be safe. But to date, the vaccine profiles and safety have shown to be on par with other vaccines that are available to the community. So I feel very comfortable continuing to promote that we all get vaccinated. There's been no indication that there would be any issues with hormone replacement therapy or any antiretroviral drugs that might interfere with that. So that is another thing I'm able to confidently say at this point, that continue to still promote getting vaccinated in that community. Immunocompromised patients, while they may not have as good of a response, will still have some response, and we'll see how that might play out in the future, whether or not there needs to be boosters for the vaccine for certain populations. But again, all reasons to still get vaccinated. But back to my cultural example that I was surprised by, it made me stop and think about all the different questions I might be getting, and how I could be prepared for answering those questions. The safety is one of the first. How did we get a vaccine that came out so fast? How can we trust it? And the science was there. And when the whole world paused and stopped, and we had to all collaborate and share resources, and immense amount of funding all at the same time, it really, I think, was the driving factor for getting something this quickly. And the manufacturing specifically for mRNA vaccines is a lot faster and easier to produce than more traditional vaccines. So that's partly why we saw that come out so fast. I do feel kind of like broken inside that the HIV community specifically would take pause and say, hey, but why, we've been dealing with this for decades now. What about us? And I mean, it does take the advocacy that Tim and Maurice are discussing, that someone has to stand up and shout and say, hey, like, we need attention too. So I'm hoping that in the future that's something that we can also take advantage of and have access to. For now, the hesitancy piece continues with this. And as you guys discussed, that hopefully with education, we'll be able to provide this confidence that this population needs. Oftentimes for hesitancy too, I'll bring it back to what we do know. So like Joel said, the risk of getting the virus versus the vaccine, there are very low incidences of anaphylaxis, mostly in patients that have known anaphylaxis. So that's something that we can be prepared for.
Yeah, it's interesting. You're talking a lot about trust, and it was interesting the example or the story that you told about the two relatives and trust and the different perspectives that each had. I guess, Joel, I'm wondering if there's anything else that you are hearing or seeing, again, those with trust issues. Are you hearing of any medical considerations for LGBTQ people, and anything else you could add there?
Yeah, I think I would echo, really everything that Erica said. We're starting to see from COVID, patients that they call long haulers who have sort of these long-term issues that we haven't seen an end to yet with COVID. And if they had had the opportunity to have a vaccine, they would not have that, right? And I think we have to think about when someone says, I'll just take the risk to get the virus, what that could mean to you, especially in the HIV community and for someone who might be immunocompromised or otherwise, right? So I think it's important to say that all three vaccines are equal, and as soon as you can get one is the important one. My son, who's a scientist in a cancer lab, my sister-in-law was sending messages like, which vaccine should I wait for? And he started sending her some information based on his little scientist background. And I said, no, stop saying that to people. Because before you know it, she was texting me, should I wait to get this other one? I said, absolutely not. And I said to him, you have to think about the impact you're having by sending that in a group text that you're probably saying at work with your little scientist background to the ultimate impact. So I think by me talking to him about it, I actually changed his opinion a bit. So the next time that question came to me, probably would have said, yes, just get it, right? And so those are the type of things within our community that's going to be important. We have to know you might get pain at the injection site. There might be some tiredness. You might get a fever. You might see chills, joint pain. I know lots of people now that have said that they got that. Some on the first dose say they get it. Some say they get it on the second dose. Some say they've had absolutely no symptoms at all. So you got to be prepared for that. Know that it's working, right? The vaccine is working if you're getting chills and other things that are happening, and it'll subside itself in 24 to 48 hours, and you're going to be good and you can be back out there. So I think that's what's important. Again, like I mentioned before, we should be talking to our own people in our community. We know from our health equity work that when Black people talk to Black people and brown people talk to brown people and gay people talk to gay people, they're much more apt to learn and to believe the information, the education that they hear. So it's ultimately all our responsibility to providing that education and the data to those folks. So that's where I think we need to all, sort of play a role.
I agree. And it's interesting because I have actually, I've been fortunate to moderate a number of panels, discussions here with, Dr. Sri Chakaturu, the Chief Medical Officer at CVS Caremark. And, he's been extremely, extremely close to the vaccine, all of the research, all of the data, and getting that information out. It's interesting when you were just telling that story about your son and about these three, the three currently authorized vaccines out there. What we've seen right now And it is hard as a layperson to go through all that and see all the data, hear what's being shared. But the important thing that we have to make sure that gets out there, that people understand across all three of these vaccines, is that it's nearly 100% efficacious at preventing hospitalizations and deaths. And that is really the most important, sort of efficacy metric that we should be looking at. And we have to make sure that education's out there. Joel, you were talking about I think you already were starting to hit on how could we overcome vaccine hesitancy and having the right people connect with people in their community. Mike, I'm just wondering, do you have any other thoughts about how we could overcome hesitancy?
Yeah, I mean, what Joel's alluding to is absolutely true. Evidence has shown that when African-American or Black physicians are taking care of that population, Black people, the evidence shows that there's a higher sense of satisfaction, engagement, understanding, and trust. So, what I would say is that these aren't quick conversations. These are really an ongoing conversation. Trust is not something that is instant. So if you think about Erica's role in the community, and I love what Joel's talking about, is that we believe in Accenture that the way to help solve health equity is to get into the community and start there, because the difference of these two family members is stark, and it's showing how misinformation is really getting to people. And I think that the information is we're all probably, I would say, a level of health literacy is not to be underestimated. I think we have to think about it's sometimes, as we were just saying, it's not the message, but the messenger. And what is the message you're sending? You just said it perfectly, Tammy, which is it shouldn't be all about the studies and the science. People don't care. I've never had a patient ask me, where did I go to school? What were my grades? They just want to know, can I get a note? And does my kid need antibiotics? And if you keep it to understanding the experience, and so it starts with the last person that they had. So when you really think of the LGBTQ community, you really are thinking about what was the previous experience that they had in a doctor's office, or where they might have been discriminated against in a hospital. And so it's up to you now, the next person talking about vaccinations or to do the vaccine, to make that a real positive one. It does start off with the first interaction. I'll say too, Tammy, that it has to be around, CVS knows it can't do it by themselves, right? They're going to be doing this with a group of partners. And that's really one of the thinking that we have to approach this. It's all hands on deck. The luxury we don't have is time. That's a luxury we just don't have for this. So the sooner we get shots in arms, the better. And what we have to do is think about the community we're trying to reach. How do we prioritize them so that they are on a list, that they have an appointment? They don't have a flash screen that says, all the appointments are full. We have to find a way to do that. Then you have to present the right community and the right voices. And so there are trust brokers in communities that actually have these relationships, and you have to leverage those together. And when I mean large ecosystem partners, I'm talking national and local, and thinking through this approach where you're really talking about hesitancy is countered by the right mitigating the right methods in schools to mitigate hesitancy and misinformation. And then more importantly, how do you educate at a level that's culturally competent and linguistically competent? Those are absolute important themes in really trying to solve this hesitancy piece. So you'll have this early group of, I would say, early adopters. Yes, I want a shot. Then you have these, as Joel described, some people who just need a conversation. The aunt who reached out to her scientific nephew. The information he was sending out was obviously at a level that probably would have been more complicated and more questions. So you have to get to that middle crowd with really simple, snackable content. And then the last crowd is the one that you're really gonna have to work over time. So it's just the fight against hesitancy and trust is not something that's easy. It requires hard work, but here's the opportunity. If we can fix this here at this moment, you can fix it for other it's a durable experience, and it's a durable solution to really solving the next crises or next complicated themes, especially in the LGBTQ community.
Culturally competent messaging is so incredibly important. It's something that we've been focused on here, and I couldn't underscore that more. So Mike, I appreciate your perspective, and with that, I want to actually ask Maurice a question, because HRC, you've done a lot of research in this area. So what's the latest, again, that you're finding?
Well, first, I want to echo, like, in second, everything that was said in regards to like the last question. This question is a very interesting question. For us, on our findings, we found that first, you must build trust within the Black and Latinx communities, and also understand that the messenger makes the difference, right? So for us, when we look at like all of our findings, we come to the conclusion that, if we're serious about changing hesitancy in communities of color, then you must take like action steps, right? And there's this list that the Michigan Health came up with, but we're applying it across all of our work. And it's, number one, providing emotional support. Number two, acknowledging the uncertain risk, right? And then three, talk about those known risks, those things that we do know. And four, providing information for those who are actually seeking more information, making sure that they get accurate and sound information. Five, for us, it's, sharing the experience, your experience as a person who has been vaccinated, like really utilizing storytelling to make that change within the community. And that's what HRC does so well. Utilize storytelling to change systems and policy and community thought. And then six, tap into the desires to protect the community. It goes back to the conversation around this being a health crisis, a public health crisis. And in many ways, making sure that you are vaccinated, you're not just protecting yourself, but you're protecting your community. And then seven, most importantly, and I think everyone really just touched on it when we look at all of our findings, is, the power of partnering with community, and not just partnering with community just for the sake of partnering, but partnering in a meaningful, engaging, and intentional way.
A lot of what you're just covering, it's going back to education, trust. I mean, that's all the areas that you're touching on here. I guess, Mike, I'm interested to, we've been talking about that a lot, about building trust and things that we could be doing in the area. Is there anything that comes to mind also with clinicians and clinician training?
Yeah, absolutely. And I think this is the biggest opportunity we have. We just described this culture of not trusting because of negative experiences prior to that. So if you think of every community pharmacist being a positive role model for these engagements and interactions, and remember, we're talking about relationships, and we also are talking about how personal the COVID vaccine is to somebody being locked up for a year and getting this sort of pass to go out and live their lives. What we do know is that the health system is woefully just unprepared and undertrained and not trained well enough to cope with this. I had no classes that helped me understand all of the nuances of gender and these inequities. It's not part of the timetable, and if it's not just in medicine, it's in dentistry, and I'm sure pharmacy school too. So how might we pump the brakes a little bit and reprogram? There are some programs that are doing a great job. If we think about NYU has a program, and what they notice is that even though they take time and now are training young doctors in their first and second year to understand the nuances and how to be culturally competent, when they get into their clinical years, the third and fourth year, they've got an attending physician who just is not on the same planet. And so all of that might be wasted. So we have to have it through not just the clinical or early education years, but it's also got to impact in the later years as well. And I think that's one of the first steps that we really have to think about in terms of that. And then when we really think about this, and Erica alluded to it as well, one lesson where we have to learn in the this vaccination and how you think about almost Nobel Prize winning speed of light from time zero to vaccination. We have to think about the diversity of trial inclusion and how moving forward, we're hearing from a lot of the pharma companies how they want to be more inclusive in their research, but also solve for those social determinants of health and solve for those health equity challenges. The same goes moving beyond COVID to really try and really just change the narrative of what we're talking about in terms of education.
I hope to see that coming out of this as relates to clinical trials. Certainly, what we've experienced of late has definitely shed a light on that. So thanks, Mike. I appreciate that. Erica, maybe you could share some maybe of your best tips. I mean, I have to believe, with everything that we've been talking about, you have been encountering, specifically some hesitancy. You chatted about it before, but what are some tips that you could share? How can we learn from you?
For sure. So addressing the patient's fear and helping them put it into perspective, like Joel had suggested, making sure we address the fact that, especially for younger population, I see that they have this underlying idea that they're not going to die from this and that they don't necessarily need this vaccine. And it's not so much about the death, it's about those complications and long haulers. And statistically speaking, maybe they would survive, but what does that look like on the other side? And then, so that's for the younger, for sure, like making sure that they do know that as soon as they're eligible, they should go ahead and take advantage of that. Sometimes we talked about the messenger. So being able to identify that caregiver that you can speak with and that does trust you, and then creating that ripple effect through their community. Like my colleague, for example, she did finally decide to get vaccinated. And when her father became eligible, she and him together had made that decision. And she's told me that part of that was because of one of the things I had said. And I said, don't let access be exclusive. You have this opportunity now to get this. Don't be part of the statistic and continue the disparity. Be that voice in your community. And she was very excited about it, that she was able to talk to her father about it. And now the members of her family and community are much more open to even considering getting it. So creating that ripple effect is something that I've seen effective as far as dealing with hesitancy.
Yeah, I wanted, you were talking about the youth, and I just want to just ask Tim on sort of the other side of that, right? What's your take on what's worked best for those living in the community in a long-term care setting or the elderly?
Yeah, and I will begin by underscoring a lot of the things that have been said previously about the importance of the messenger, clear communication. Mike, I think you said snackable, which I love that idea. But when we're thinking specifically about working with older people, I think it's important to really foreground the fact that a lot of older people, when they're engaging with providers, experience a lot of impatience on the part of the provider, and they're often infantilized and treated like children. So when we talk about hesitancy, I think it's important to recognize that these are folks who are rational beings with every right to control what goes into their body. And I think we really need to start with that perspective and then think about how we go around convincing folks. And earlier when Erica was speaking, I just want to say you did such a lovely job both of marshaling the science, but doing so with warmth and being patient in your cadence and the way that you were delivering that information. And I think that kind of engagement is really key, both in terms of developing comfort with the individual person, but then that person might turn around to their friends and say, hey, this is what this person told me, I think this is fine, and it has that ripple effect. So I think really foregrounding that patience is not only an effective means of getting over hesitancy, but is kind of almost like a duty for us, especially when working with older folks. And then specifically about LGBT older folks, there's a lot of questions around location and access. So is the place I'm being asked to go in a neighborhood where I feel comfortable? Is it a place I can access on public transport? Those are really key considerations and key barriers to get past. And we've found with a lot of our folks, even once they've gone through all the conversations, they just want a buddy to go with them, someone they can trust who will go get it at the same time as them. So really kind of interrogating what's the hesitation, having those open-ended conversations to then figure out both the information that they need, but maybe the structural things that we can do to help them access the vaccine.
I think it's really important what you pointed out about, also how you're going to get there, the public transportation being able to get you there. But what I love the most that you said, Tim, and I don't think it should be lost. We talked a lot about making sure we have the right information from the right people, but it's the how it's communicated. So I really appreciate you highlighting that as well. All right. So Joel, we have heard a lot of really good advice from all your peers here, and you also covered this a bit earlier yourself. But anything else as we're wrapping up here that you're seeing? Any other information from an industry standpoint that would be helpful? And I think you said it before, but I'm going to ask you as we move over. We're going to go to Q&A, but Joel, in the way that you deliver it, I am going to ask you also the question again: should LGBTQ people get vaccinated when they are eligible?
So let me say this. First of all, there are a lot of reputable places to go. The CDC website, internally for employees or externally, the CVS.com website has lots of good resources to educate, learn about it for yourself, right? What we know today is that the benefits of the vaccine far outweigh the risks of getting COVID. And I think the more we can get that across, the more important it comes, especially in this community. We're going to see a significant increase in vaccine availability between now and May. And we're already seeing some states where anybody can get it, right? That's going to happen very quickly here, which is very exciting. And Mike mentioned before, that bottom layer of people right now is we need to be talking to them about why, when they're eligible, they need to get it. We need to make sure that people in all areas have access. I feel like CVS is uniquely positioned in those areas, but they don't all have cell phones. We need outreach to get to these patients through amazing people like Erica to be reaching out when patients are in there to say, have you gotten your vaccine? Right? I understand how our community, from the 80s have hesitancy. It's an interesting difference though, right? In the 80s, everybody wanted drug and saying the government's not giving it to me. What are you doing? And this time we have a safe and effective drug that will work and keep you alive. And people say, wait, I don't know if I want it. Right. So it's a very interesting to me sort of conundrum. Get the information you need to become an advocate. Go to those sites, those places I talked about, learn about it, understand, talk to people who've gotten it within the community and spread the word. And that's the way we're going to make sure that our LGBTQIAs are all getting vaccinated. Does that work for you, Tim?
Yes, thank you, Bill. And yes, everyone on this call could be, really advocates for getting the COVID-19 vaccine. Thank you, Joel. And thank everyone, all of you. This has been incredibly insightful. I'd like to now, we've gotten a bunch of questions, and these are really important because they are questions from our colleagues at Accenture and at CVS Health. So I'd like to spend a few minutes on these questions. Some great questions that came in. Mike, could I start with you? It really is on the topic of health equity, what we've been talking about. And all marginalized communities have had unequal access to health care, preventative, specialty, getting access to care, particularly through the pandemic. It's a challenge. So specifically, as the vaccine rolls out, how are public health officials and medical personnel proactively coming into the LGBT community and trying to overcome those barriers? What are they doing? And, again, what do you see are going to be the best approaches to bringing healthcare to the LGBTQ community?
Yeah, I just want to echo what Joel said. Absolutely. We're all advocates, and it's not just us for our own families, but we're advocates for our communities. And, I really am a big fan of stewardship in this. It's sort of, that is our mission. What I would say from the public health and the provider space is that there's genuine desire to get there. And as this vaccine volume and supply goes up, there's still going to be a waiting list, right? So I think a couple of themes or things that I've seen are, especially in the health system space, is that they early, even before COVID, we'll take, for example, Nyack Hospital. Dr. Geller is the CEO there. He recognized that the LGBTQ community was being marginalized, that they weren't having a positive experience. It had nothing to do with hospital scores. It was just about getting delivery of care to them. And they actually refurbished and revamped how they communicate and how and taught their clinicians from, it was mentioned earlier, from the frontline worker at the triage nurse to the clinician to even the unit secretary. That mindset helps level set a sense of trust. So that's the long game, right? But what they're doing now is they're reaching out, and you have to meet people where they are. So there are these efforts to do what's called a pop-up clinic. So you just laptop, iPads, and a tent. And you go in some communities where you may not have the real estate. So if there's not a CVS pharmacy there or a public health service entity, you go to the libraries, you meet people at the church, you meet people at the YMCA if they're engaged. Depends on who that we talked about earlier, the ecosystem of partners. So that's one theme. And then the other piece is where do they feel like they can actually make an impact? So some entities may just have messaging only. Others may actually have an army of volunteers. And believe it or not, it's interesting. I come from a technology company, and we always think like, what is the coolest way that we can give somebody an experience? And turns out that you go with the lowest denominator for that community. And Joel alluded to this, it's the digital divide. So yes, it's great to have a website that's always operating and has appointments, but if people can't get to the website, don't understand the questions being asked, that digital literacy, the health literacy, and the digital divide are big impacts and barriers that have to be overcome. So as Tim described, you may need a buddy. Like I helped my mom get her shot. And how do we help other people in the same way? So I would say that those are all the things that are being done proactively. It's not the full answer, but I think it's a start, but we have to start, right? We've been talking about how we're going to do these things. But now it's time to take action and really, and some of these things may not work. It turns out you may have to canvass like you do for votes, and the NAACP in Atlanta has done that. They've actually had little barbecues to try and get some vaccine, so sometimes it's door to door, and sometimes it's, Tammy, you're a marketing person, sometimes just a simple flyer that gets the message across.
We need all of those. It's a layering effect, and it's personalized, and it's not can't be one size fits all. That's for sure. Really important question here, and Maurice and Tim, I'd love to hear both your perspectives on this. So to avoid biases, there's a pretty large amount of covering that still happens, among some to feel safe. So with the pandemic, with social distancing, there's been really a limitation to safe spaces and covering opportunities to build that safety. So how do the LGBTQ people seek mental health or addiction treatments when the avenues really could be so narrow, especially right now with this lack of or still limited in-person social cues, also in telehealth? So Maurice, let me start with you.
So what we've done is we've really put a lot of resources and time into our minority-led and serving community-based organizations, right? These are the organizations that in many ways are the gatekeepers to and the first point of access to care for a lot of LGBTQ people of color, right? So what we've done, we've tried to provide them support. Some of the organizations are doing telehealth. Some of them, have received PPE funding from the federal government where they're able to, reopen their shops. So essentially just helping get the messaging to community, utilizing our communication networks. We are in a process right now of developing a storytelling campaign that really focuses on the effect that COVID has had on communities of color, particularly folks who are living with HIV. And in that campaign, having people tell their stories about, how and where to seek care in the middle of the pandemic. It's in partnership with our community-based organizations, so we can use them as a referral organization. So people can see, this is not just a public education campaign, but these are the organizations that you can go to still access services. I think we found out relatively early in the pandemic. Well, one, a lot of our minority-led and serving organizations had to close their doors, right? Because they did not know what they were facing as it relates to COVID. They had no idea when they could reopen. Some of them are open again now. So it's just a matter of making sure that people have access to those services and know that these organizations are still on the ground doing the work.
Tim, anything to add?
I'll jump in briefly and I'll talk about the systems level and then a little bit about the interpersonal level to address this question. At the systems level, I think it really underscores the necessity for staff training, which we've talked about, outreach that's not only LGBTQ affirming, but is really backed up by providers who can deliver on that sensitive care. And I say that because folks' options are limited in terms of where they can reach out to. So if we can really create a world in which there's no wrong door for someone to walk through virtually or physically for services, that's going to have a huge impact. In terms of people who might be living in an environment that's not welcoming, everything moving online has had a positive impact in that people are now able to access recovery groups, social groups, things through Zoom that they might not have been able to go to in person. So I think there's learnings there that we can leverage and that SAGE has tried to leverage. But I do also want to point out that those require the ability to both purchase, maintain, and use computer equipment and have access to high-speed broadband, which is not available uniformly across the country, especially for folks who are in rural communities where those more lo-fi interactions, the Meals on Wheels delivery person could be the best person to connect you to services. So really thinking about the broad spectrum of ways that folks might have touch points with providers is going to be important.
Thanks, Tim. Joel, question for you. I'm going to pose it to you. So if scientists can create the COVID vaccine this quickly, why can't they do it for other viruses, including HIV?
Well, it's a really good question. And I think, we've learned a whole bunch, right? All of us, about viruses over the last year. And HIV, first of all, people who are on antiretroviral therapy live normal lives to the same age, right? And they're preventing the virus within their body. It's a unique virus in that it can hide away from the immune system, right? It hides within CD4 lymphocytes, and it hides there as we're preventing it from replicating. So people who are HIV positive and take their medication every day, it keeps the virus at bay. It's a really important thing related to adherence and other things as to why you need to take that tablet every day, which is a whole different discussion, but it prevents that virus from replicating again. And if you stop taking it, very quickly it will come back and replicate in your body and you can be in trouble. And in fact, that drug might not work anymore if you were to do that. So I think two things. One is there's so many attempts to do this within the HIV world. It is a tricky, difficult virus to come up with a vaccine for. We've been trying it for years. The good news about COVID, it is not a tricky vaccine. Although it's very catchy and it transmits very easily, it's not a tricky vaccine. Like Erica mentioned, in a week, everybody had exactly what it was. And so, but we might learn from all these mRNA vaccines and different ways of looking at it that who knows, maybe someone will come up with some vaccine that actually works. I hope and pray that that's true, because it would be nice to end this epidemic. But with that said, we're on this journey through PEP, through PrEP, through HIV therapy to decrease the vaccinations by 2030 by 95% and end the epidemic in the United States, just like we're going to do with COVID. So that's my 2 cents on that one. Tough one to answer too.
It is a tough one to answer. But 2030 baby is the t-shirts that we're going to make up for everybody, right? So, Maurice, during the pandemic, some young LGBTQ community members, this is a very super important question, because they've lost physical contact with their supportive social networks, while they had a quarantine, with rejecting family members, a really difficult thing. So what have you been seeing the impacts on mental health during COVID-19 vaccine, particularly for the youth? And then, Tim, I'd ask you probably the same thing for the elder populations.
We have two community engagements that we started prior to the pandemic. One is You Are Now, which is our engagement with our house and ballroom community. Those are young individuals, 18 to 24-ish. And then we have our Community Voices, which is designed for Black, gay, and bisexual men. The ages range about, early 20s to like late 50s, early 60s. And in both groups, we have seen or heard in conversation that, mental health has this isolation has really kind of like threw a wrench in like their mental health and or stability. So we realized that we're providing outlets and opportunities and spaces for people to come together as community to commune and to talk about our shared experiences and what we're dealing with as it relates to being people of color in the community. And then think about, in the middle of all this, we had civil unrest, right? So it's been a lot on the community, and it has had a lasting impact. But for us, we understand the importance of making sure that we provide these spaces for people to come together and actually like have these real open and honest conversations, and not just in like a silo. We also make a point to bring in public health professionals to help facilitate and moderate these conversations, right? And then we bring in some of our federal health partners and community-based organizations so that they just not have the opportunity to talk about what's going on and, their current mental health, but also know what are some remedies to addressing some of their mental health concerns, but then more importantly, where they can go to actually seek help or assistance as it relates to dealing with some of those mental health challenges during this isolation.
I would add to that too that many people are experiencing mental health crises right now. This is really unprecedented in terms of the amount of isolation. A lot of us are feeling the amount of lives that we're living online. And I think when we approach kind of comprehensively the topic of mental health, it's important to take a step back and think, okay, is this a mental health crisis that requires a behavioral health intervention? Or does this person have material needs that are not being met? Is this person getting adequate food? Is this person experiencing another health condition that's impairing their cognition but is going untreated? So because we're less able to be in person with one another and notice all of those physical cues and kind of the comprehensive way in which we assess people, it can be difficult to determine what's really going on with each individual person, especially over a platform like video chat. So again, it really underscores the importance of folks getting vaccinated so that we can get back to in-person clinics, we can see each other in real life, we can connect to those services and really get a feel for how our community is doing in a very holistic sense.
Great, thank you both for that those comments there, and I just want to thank all of you for the insights today. These are the kinds of discussions that we need to have. We need to have them among ourselves. We need to have them within the community. We need to promote COVID-19 vaccine adoption and really improve health equity for the entire LGBTQ population. I just want to thank each of you for taking your time today, for being, just so open and engaging with the audience today. On this health equity journey that we have, because this is it's the first of our 4-series panel that we have. So please, everybody, watch for the additional sessions, the additional features. Thank you again, and here's to everyone and our collective health. Thanks.